Welcome back to Bedside Banter Manor. In our previous episode, episode 5, we discussed making the decision to send a resident to the hospital. Today, we will work through a root cause analysis and discuss the findings, the importance of oral care for pneumonia prevention. Disclaimer. The goals of this series are to educate nursing home team members on pneumonia prevention and rehospitalization. This episode aims to provide essential information for transmission-based precautions and respiratory hygiene. It is designed to enhance staff training and improve resident care at Bedside Banter Manor. It is purposefully clinically focused with the understanding that real-life scenarios or situations being depicted would be more comprehensive and holistic in nature. Key elements have been intentionally left out to encourage open discussion and dialogue, identifying situations and areas where improvements could be made in the care or services during Rosa's current stay at Bedside Banter Manor.
Nurse Johnson, let's review Rosa's recent rehospitalization. We need to understand what opportunities for improvement we have and how we can prevent this from happening in the future.
Agreed, Dr. Green. I've been thinking about it a bit, and Rosa was living independently before moving to our facility. Oral care wasn't part of her initial care plan since she managed it herself.
Interesting. Did we notice any issues with her oral hygiene after she arrived?
Actually, yes. Rosa was afraid to move around on her own and didn't practice proper oral care. She didn't mention needing help, and we missed it during our assessments.
That could be significant. Poor oral care can lead to pneumonia, especially aspiration pneumonia.
Absolutely. Here are her records. It seems that maybe her oral health deteriorated, leading to bacteria buildup in her mouth, which likely contributed to her pneumonia.
It's clear that Rosa's pneumonia was a result of poor oral care. Moving forward, we need to ensure all residents receive proper oral hygiene assistance, especially those who might be hesitant to ask for help. Let's get the rest of the team in here to talk a bit more about it.
Thank you all for joining us today. We've conducted a root cause analysis for Rosa Residente and have determined poor oral hygiene to be a likely cause of her pneumonia. That being the case, we wanted to discuss the importance of oral care with you all today.
The reason for providing, assisting, and teaching residents about good oral hygiene is that it helps prevent pneumonia. Poor oral hygiene can cause germs in the mouth to multiply rapidly and trickle down into the lungs during sleep. When oral bacteria in the saliva enters the bronchi and lungs, it is more likely to result in a type of pneumonia called aspiration pneumonia.
The risk of aspiration pneumonia increases when gum disease, dental cavities, and poor oral hygiene are compounded by swallowing difficulties, feeding problems, and poor functional status.
Routinely brushing teeth or dentures and gums can help remove these germs and aid in preventing aspiration pneumonia. We'll take you through the best practices now.
Oral care helps remove plaque, which is essential to prevent tooth decay, gum disease, and pneumonia. It also helps people eat healthy foods and prevents mouth pain. Plaque is a sticky film filled with germs that forms every day on teeth. Thick plaque forms if a person doesn't brush regularly. Germs from this plaque can get into the lungs and cause pneumonia.
For residents with natural teeth, set up a soft bristle toothbrush, a fluoride-containing non-foaming toothpaste, alcohol-free mouthwash, petroleum-free lip moisturizer, and a basin if the resident is unable to get to the sink.
If the resident has a removable device such as dentures or partials, or they have other special oral hygiene needs, you may need to gather additional supplies such as a suction toothbrush, dental floss, products for dry mouth, oral rinse, and denture supplies.
Some residents can complete their own oral hygiene. For these people, your role is to make sure they have the supplies needed and give them reminders regarding the best oral hygiene practices. If they can brush their own teeth but need help with setup, make sure you wash your hands and apply gloves prior to setting up their supplies. Remind the resident to brush their teeth for 2 minutes and finish by brushing their tongue. If able, it is also good practice that they floss their teeth after brushing and rinse with mouthwash for 20 to 30 seconds. Make sure all disposable items are thrown away. Remove your gloves and wash your hands when finished with any assistance you may have provided.
Ensure that the resident's oral care supplies are labeled and stored in a clean, dry place.
Residents may need your assistance with oral care. For most residents, oral care should be provided at least 2 times a day. For example, after a meal and before bed. Oral care should be a part of every resident's care plan. Whenever you are entering a resident's room, make sure to knock first and introduce yourself. If they are unable to get out of bed, elevate the head of the bed if allowable. Otherwise, assist them at the sink in the bathroom. After providing for privacy and explaining what you are going to do, wash your hands, arrange supplies on a clean towel, position the resident and cover their chest with a towel. Then put gloves on your clean hands.
Wet the toothbrush and put a small amount of toothpaste on their toothbrush. Then carefully brush their teeth, including the inner, outer and chewing surfaces of all upper and lower teeth. After allowing the resident to rinse and spit, brush their tongue, being careful not to make them gag. Assist them in rinsing and wiping their mouth.
After assisting with oral care, clean up the supplies and put them away. After removing the towel and placing it in a linen bag, rinse the sink or emesis basin and the toothbrush. The toothbrush should air dry. All equipment should be stored in a clean, dry place. After putting the supplies away, remove and throw away your gloves, then wash your hands. Once you have left the room, document the task and report any oral issues or other changes you may have noticed regarding the resident to the nurse.
When assisting with oral care, watch for things in the mouth that you should report to the nurse, such as pain, sores, blisters, ulcers, swelling, growths, lumps, red or white areas, broken or decayed teeth or dry mouth. If you notice broken or cracked dentures or teeth, report that to the nurse as well.
If a resident has full or partial dentures, they should be removed every night. After washing your hands and applying gloves, help the resident remove the dental appliance as needed. Whenever removing appliances such as dentures or partials overnight, be sure to soak them. Soak them in warm water with a denture cleanser to loosen plaque and tartar to prevent gum irritation and possible infections. Then remove your gloves and wash your hands.
After soaking, it is important that you clean dental appliances as well as the resident's mouth. Fill the sink with water or line it with a washcloth to cushion the dentures in case they are dropped. Before rinsing the appliance, wash your hands and apply gloves. Brush the appliance with warm tap water. Using a separate toothbrush with water, brush the roof of the mouth, the cheek surfaces, the gums, and the tongue. If able, ask them to swish with mouthwash and spit, or, if they are not able, use an oral swab.
Once the device and the resident's mouth are clean, it is time to reinsert the dental appliance. To help keep the appliance in place, apply adhesive per the manufacturer instructions and assist them in inserting the dental appliance as needed. Then, remove your gloves and wash your hands. Be sure to label all equipment and store it in a clean, dry place. Once again, document the task and report any oral issues or other changes in condition to the nurse.
Phew, that was a lot of information. Any questions?
What do we do now that we've identified this as the root cause for Rosa?
I'll update our care plans to include regular oral hygiene checks and assistance for all residents. We will be doing a performance improvement plan, including assessing all residents for the level of assistance they require with oral hygiene upon admission, quarterly, with significant change in PRN. We will also conduct oral hygiene audits to be reviewed in copy meetings. As we increase our focus on this, I'll also be putting together a routine schedule for changing out oral care supplies such as a new basin/toothbrush every month.
Agreed. This is a crucial step in improving our care quality and preventing similar cases in the future. Thank you for your thorough review, Nurse Johnson.
Thank you, Dr. Green. And thank you all for doing your best. Let's ensure Rosa receives the best care when she returns.
Today, we learned the importance of identifying the root causes of rehospitalization through thorough reviews and assessments. In Rosa's case, it became clear that poor oral care was the primary factor leading to her pneumonia. This revelation underscores a critical aspect of resident care that can often be overlooked. At Bedside Banter Manor, our goal is to provide comprehensive care that addresses all aspects of a resident's well-being. Oral hygiene might seem like a minor detail, but as we saw with Rosa, neglecting it can have severe consequences. Germs in the mouth can multiply rapidly, and during sleep, these germs can trickle down into the lungs, causing aspiration pneumonia. This type of pneumonia is particularly dangerous for older adults and can lead to significant health issues and even death. By implementing regular and thorough oral care routines, we can significantly reduce the risk of aspiration pneumonia. This involves not only assisting residents with brushing their teeth and dentures, but also ensuring that their oral hygiene supplies are correctly set up and maintained. Simple steps like brushing for 2 minutes, flossing and using mouthwash can make a substantial difference. Remember, it's not just about following protocols. It's about understanding the why behind these practices. We need to educate our teams on the importance of these routines and ensure that every resident, regardless of their level of independence, receive the support they need. This includes regular assessments and being vigilant for any signs of poor oral health, such as pain, sores, or broken teeth, and promptly reporting these to the nurse. Our commitment to continuous improvement means we learn from every incident. Rosa's case has taught us a valuable lesson about the interconnectedness of various aspects of care. Moving forward, we'll incorporate these learnings into our daily practices to prevent similar occurrences and ensure our residents' health and safety. Now, we would like to hear from you. What could Bedside Banter Manor have done better? What other opportunities for improvement did you see? Thank you so much for joining us here at Bedside Banter Manor. We hope to see you again soon.